Hello friends, today I am going to discuss about a second clinical case scenario. Let us look into the question. A 16-year-old boy came with complaints of fever and breathlessness for 1 week. He gives past history of sore throat followed by joint pain involving both knees 4 to 5 months before. On examination, small painless subcutaneous nodules were seen on hands and feet. Auscultation of heart revealed pansystolic murmur and early diastolic murmur. Let us look into the questions. First question: what is clinical diagnosis and how you arrived at it? Answer is, based on the history and clinical examination, the clinical diagnosis is acute rheumatic fever. Now let us look into the second question. Name etiological agent of this condition and underlying pathogenesis. Streptococcus pyogenes is the etiological agent of the acute rheumatic fever, and the pathogenesis is autoimmunity due to molecular mimicry of the antibodies targeted against the streptococcal antigens. Streptococcal antigen is M protein that which cross-react with human tissue antigens such as heart and joint. These cross-reactive antibodies bind to valvular endothelium leading to the damage of heart valves. And streptococcal toxins is otherwise pyogenic toxin and enzymes streptolysin O are toxic to the human heart. This is the underlying pathogenesis. Now let us see third question. Describe the diagnostic criteria used for this clinical condition. Diagnostic criteria for rheumatic fever is modified Jones criteria and includes clinical signs and symptoms. Laboratory parameters such as ESR and CRP are seen and ECG changes are seen. Let us see the fourth question. What serological diagnostic test can be done and explain principle, procedure and interpretation of this test. The serological test is called as ASO antibody test. ASO means anti-streptolysin O antibody test. Principle of this test is latex agglutination test. Polystyrene latex particles are used as carried molecules which are capable of absorbing several types of antigens. Procedure of ASO antibody test. A drop of patient serum is added to drop of latex solution coated with antigen on a black colored card and mix it well by rocking the card. Interpretation of this test. When there is visible clumps, it indicates presence of ASO antibody in patient serum that results in positive, whereas when there is milky white suspension with no clumps, it indicates negative. Now let us look into the fifth question. Describe briefly the prevention of recurrence of such episodes. Answer is long-term penicillin prophylaxis with intramuscular benzathine penicillin, which is given every 4 weeks, helps in prevention of recurrence of such episodes. Thanks for watching. Do like, share and subscribe the channel. Thank you.